hear from you.
Okay. Well, hi, everybody. So my name is Ashley Ronk. Yep. So I graduated from NC State in 2005 with a bachelor's in chemistry and a minor in biology. I worked for a few years for a chemical manufacturer. I graduated doing project management with a manufacturer in China. And then I decided to go back and get my master's. So I went to Methodist University down in Fayetteville in, 2012 and finished in 2014. And then I was working in Fayetteville for an orthopedic practice as a PA for 2 years before I moved to Rex to do cardiology. I did outpatient medicine with orthopedics mostly, with a little bit of inpatient, and now I do exclusively inpatient. So that's kind of the long and the short of it as far as my background. I don't know if people have specific questions about the path to PA school or what exactly I do.
Yeah, I just don't know if you're in a rush or not.
If you're what?
I think we're going to hold questions till the end.
Okay.
But just to finish you off, will you just give a day-to-day, what you do on a daily basis, I guess?
Sure. So I do a bit of a mix of things. So for the most part, we do admitting patients through the emergency room or patients that have been transferred from other hospitals that need a higher level of care. So we get them settled in the hospital and also like figure out what's wrong with them and start their treatment. And then we also round on them every day while they're staying in the hospital and adjusting their treatment. And just kind of working them through their hospitalization. In addition, we do consultations for people that are admitted under other services and then they develop cardiac issues. They'll ask our group to kind of assist them. So we'll do those consults. So mostly I go in and I see the patients and take care of, come up with my own assessment and a plan of care. And then I talk with my attending to kind of review that course of treatment with them. And then we also, it's just, discharging from the hospital and coming up with a plan for follow-up care and things like that.
Awesome. Thank you so much. We'll get to questions at the end, but thank you for that for now.
Sure.
All right, next up.
All right, next up, we have Brandy Wilson, a vascular surgeon PA.
That's me.
Oh, perfect.
All right, so hey, my name is Brandy. I've been a surgical PA my entire PA career. I graduated in 2004 from ECU. I know, I'm sorry. But I did my undergrad and majored in biology at Neri-Mynatt in western part of North Carolina, and took a year off in between undergrad and PA school because I really didn't know if I wanted to go to medical school or if I wanted to be a PA or what exactly I wanted to do. So I took that year to kind of figure things out and met with people who were PAs. I didn't know a lot of NPs at that time, but I did know a couple of PAs through another friend of mine who was doing a 3-2 program at Wake Med or through Wake Forest PA program at that time. So I had a few inside information there and decided ultimately to go to PA school. Absolutely loved it. And on rotations, I really thought I wanted to do pediatrics because I loved kids and my mom was a pediatric nurse. And so I thought that's just where I needed to be. And then I did my pediatric rotation and I loved the kids. I hated the parents. And so I had actually fallen in love with my surgical rotations. I had done cardiothoracic surgery, plastic surgery, and orthopedics. 2 of those were electives. The other was I did CT surgery instead of an 8-week general surgery rotation, and actually was going back to work with the cardiothoracic group at ECU, and they said, hey, Vascular's never had a PA before. Are you interested in meeting these guys? So I walked into their OR, they were playing music. Everybody was super happy and excited to say hello. And it just felt like a good fit. And like I said, that was in 2004, and I was with the ECU group until about 3 years ago when I made the move to Raleigh, and I'm working with the vascular surgery group here. And again, absolutely love it. Vascular surgery patients are a unique niche of a patient population to take care of. But kind of day to day, I work strictly inpatient now. I've done outpatient and inpatient and a little mix of both. As far as taking care of patients on both sides of things. I really enjoy the inpatient side. It's a little faster pace. There's, you never know what you're going to get on a day-to-day basis, what's going to show up in the emergency room, what's going to happen in the operating room. As a surgical PA, get a lot of hands-on in the operating room as far as first assisting, and then we're the ones that close at the end. The surgeon scrubs out, and we finish up closing up and making it a nice cosmetic finish for those patients. And then of course we round on the hospital patients, taking care of their admissions, discharges, any wound cares. We pretty much round on the patients independently during the day. We come up with their plan as far as their day-to-day activities, and then discuss, of course, with the attending physician. And then if we need to make changes, we certainly do. But it's a great relationship. It's a very unified relationship, and like I said, we've got a good one with our docs here. That's about the work aspect of it.
Thank you so much, Brandy, for that. And I have one question for you and Ashley, just to end off the PAs section. What did you guys do? Because I know a lot of people will be wondering this. What did you do to get your hours for PA school?
Oh, good. Okay, so I'm really old, so it's a lot different now than probably what it was back then. We didn't have to have as many patient contact hours. Whenever I applied for PA school, I think we only had to have like 1,000 patient contact hours. I think there's more now, at least 1,500, if not more than that. So how I got my patient contact hours were, again, my mom was a pediatric nurse. So in my summers that I had off I knew I needed hours for either going to medical school or to PA school. And so I spent the summers helping shadow in the pediatric office, and then helping with an asthma coordinator with education for patients and their parents. So I got a lot of patient contact hours in the pediatric department. And I also worked with a pathology group in college, which was really cool. You don't get a lot of patient interaction, but I did get a lot of lab hours through that. And it was still considered patient contact hours, even though you weren't physically seeing them. So I made up a lot more, like I said, on the pediatric side. And then, between that, shadowing too, whenever I could, just to see different specialties in the PA programs.
That's awesome. Thank you. And again, I could see you're at work, so thank you for taking the time to talk to us.
Yeah, no problem.
Ashley, did you want to share what you did for patient care?
Sure. I did a couple of different things. So I went and became an EMT, and I actually worked with, I volunteered with Carey EMS. And so I did an EMT basic. So that is really the least that you can probably be allowed to do in helping with the ambulance. But so I wasn't administering any medicines or any, starting any lines or doing anything like that. But a lot of it is talking with the patients, doing some assessments, and getting kind of acclimated to that part of the role. And helping with transport and getting them to the emergency room and things like that. And then I also, so using my kind of EMT background, they allowed me to go in, and I actually volunteered at a cardiology office in Cary and did rooming patients. So I kind of triaged, took blood pressures, got histories, went over medicines, that kind of a thing, to finish off my time, got EKGs.
Okay. That's awesome. Thank you so much.
Sure.
And then I think we're on to the nurses and nurse practitioners now. Or actually, sorry.
Is Gabby here?
Yes, I'm here.
Oh, okay.
Yes.
So we have one more PA.
Sorry about that.
That's okay. I'm Gabby. I'm not an NC State alumni, actually. I graduated from UNC Chapel Hill.
Oh, sorry, my mom told me
That's okay.
wrong.
That's okay. I graduated from UNC Chapel Hill in 2013. I studied biology and chemistry. After I graduated, I knew I needed patient contact hours. So I worked for North Carolina Heart and Vascular Research at Rex Hospital. And that was primarily doing cardiovascular research studies. So I consented patients before their procedures, got to be in their procedures, and saw them afterwards in the clinic. So I did that for 2.5 years, and then I applied for and got into PA school. I went to PA school also at UNC Chapel Hill. I was part of the first class of the physician assistant program there. And then I went on and graduated from PA school in 2017. And then I started working for North Carolina Heart and Vascular at Rex Hospital in 2018. So I've been there now 2.5 years, and Ashley works there as well. So she has already gone beautifully over what we do on a day-to-day basis. But we're seeing patients through admissions and consults. There's a stress testing department that the PAs and nurse practitioners monitor. And then seeing patients in the hospital as well, just rounding on our patients that are admitted to us. And that's it from my end.
Cool, thank you so much. And we'll get to more questions at the end. I know people have some.
Yes.
And sorry about the NC State alumni.
That's okay.
All right, I think we're on to the nurses now.
Yes, we are. So
Celia Berger, you're up.
Hey, my name is Celia. So I'm originally from Raleigh, North Carolina, and I went to University of South Carolina where I got my bachelor's in nursing. And so to kind of talk about nursing program in undergrad, so I first applied to South Carolina as nursing, and when you're first admitted, you start in lower division. You spend the first 2 years in lower division, and then at the end, the spring semester of your sophomore year, you have to apply to upper division. So at that point, it strictly was based off of our GPA to get admitted into upper division. And from that point, it went from, I believe our class started about maybe like 400, and then upper division was about 130. So they cut it down to less than half by the time you got to upper division. From there, they had 2 starts, so I could have started in the summer or I could start in the fall for upper division, so that's my beginning of my junior year. I said I would do either, so I started actually in the summer, which put me to graduate December of 2017. So from there, starting upper division is when you really get into the more intense courses. So you're taking your patho and your pharm, and you start your clinicals. And from there, it's much more hands-on. And they have the mannequins in your health assessment class. So you get to do that portion of the practice before you go into the patient care setting. From there, also in your courses, to get you prepared to take your boards after nursing school, we did ATI testing. So that's kind of like a second set of testing on top of your course testing. So we would have 2 final exams. You'd have your ATI to prep you for your boards, and then also your final exams for that class. And then at the end of your senior year, you'd take a 3-day course, which ours was ATI, to get you prepped for your boards. And from there, you take NCLEX. So because I was University of South Carolina, but I was sitting for my North Carolina Board of Nursing license, it took about a month to get my diploma sent over to North Carolina. So I graduated in December and then took my boards early February. And then from there, because North Carolina is a compact state license, I'm able to practice in Atlanta, Georgia. So you'll kind of learn this for my nursing people, that a lot of the states now are compact licensed, so it gives you the availability to travel. A lot of nurses have been taking travel assignments, especially during this time. And you can also practice in a lot of states. You can move anywhere. So right now, I started a nursing job when I first moved here on the progressive cardiac care unit at Northside Hospital in Atlanta. I worked there for about 2 years, and I currently still work there PRN, and I took another full-time job in the admit recovery unit. So it's pre and post patients that go to the cath lab that have ablations, they get pacemakers, defibrillators, and we recover moderate sedation and then also general anesthesia patients. So I'm getting to see a lot more of the procedural side in this job. And then also while working, I'm in the acute care nurse practitioner program at Mercer University down here, studying to become a nurse practitioner. So working full time, and then also I'm doing school part-time. So I'm set to graduate December of next year.
Awesome. And your email is on the slide. So if anybody wants to contact her, she said that was great for questions. And we'll probably get back to you with more questions. So thanks for now. I think we have a nurse practitioner up next.
We do. Chris Harville, are you there?
Yep, I'm here.
Oh, wonderful.
So my name's Chris. I took kind of a slightly different path to this than everybody else so far. I originally graduated from East Tennessee State in 2002 with a degree in 3D animation and graphic design. Kind of messed around with that for a little while, did some construction for a little while. And then one night I was talking with my wife and talking about how I'd always wanted to be a firefighter. And she said, well, maybe you should try that. So I contacted someone and kind of got a plan in order, which first started with getting my EMT, or my first responder, I'm sorry, which is kind of below EMT, it's kind of EMT basic. So I put myself through that program. It was a couple of weeks. Then I went on as a volunteer at a fire department who put me through EMT school. And it was a little different at the time. It was a ENT IV, which meant that we could give some meds. Did that for a little while with the fire department. They did to send me to paramedic school. So I went to paramedic school and then worked on an ambulance for a couple of years. And after I had my first kid, ambulance it's nice, but the schedule is 24 hours on, 48 hours off. So I would go a day, day and a half, sometimes 2 days without seeing my daughter. So we got to discussing other options. And there's a program at Vanderbilt where it's a bridge program. So you just have to have a bachelor's in something. And then you basically do 1 year of nursing school. So they take the 4 real semesters of nursing school and put it down into 3 semesters. You do a big capstone clinical at the end, and then you have to take the NCLEX, pass the NCLEX, and then you go to your NP year, which is another 3 semesters. I chose to do an intensivist program. So I actually rotated through all of the ICU units at Vanderbilt. I started in the neuro ICU for 2 months and then went to CV ICU, to the burn ICU, trauma ICU, and then a surgical and medical ICU. A lot of the jobs that I had in Nashville were kind of like night jobs, weekend jobs, typical first graduation jobs. And we decided to look at moving to Raleigh. Got offered this job here about a month after Gabbi did. I think we actually interviewed the same day, and been here for 2.5 years. So I mostly work with peripheral artery disease, which is a kind of unique group of patients. I work with a lot of the same type of patients that Brandy did from earlier. My doctors do their interventions from the inside, and they're usually very complex, very sick, have a lot of different issues, a lot of social issues that you have to work through.
Awesome. Thank you so much. You have a really cool path of getting to where you got today.
It's a long path.
Yeah, but sounds exciting. All right, next up, I believe we have Marianne, who's sitting right next to me.
Hi, I'm Marianne Berger. I'm a nurse practitioner, and I have a longer path than Chris. I started nursing school back in 1984, and I have a BS in nursing. In 1986, I graduated from West Virginia University as well with a degree in exercise physiology with a focus on cardiac rehab. And I picked that because it was a new degree, and my dad had a heart attack the night I graduated finally. In 1996, then I was in the second nurse practitioner class at Duke. And so I just went to school because I wanted more autonomy, and I had no clue being a nurse practitioner would be what it is today. As far as my work experience, I started working at Duke in the medical ICU, worked there for 9 years, worked in CCU. I started the heart and lung transplant program for adults and kids at Duke. And then I worked with the Department of Anesthesia and with pulmonary hypertension, which was I did clinical research as well as treated patients with pulmonary hypertension as a nurse practitioner in the clinics. And that's kind of a disease with people that took the drug fen-phen years ago, and it was a diet drug and caused high pressure in the lungs and they dropped dead, but you can get the disease from other entities. Then I started working at Cary Cardiology, and I went to the 3 hospitals around here, did in and outpatient cardiology rotations. And then for the last 8 years, I've been with North Carolina Heart and Vascular doing inpatient care in the hospital. And in addition to this, and one thing I want to emphasize is the amazing thing about our field is you can do other jobs as well. I currently work 3/12s, and I have extra time on my hands with nothing to do, right? So I work on the side at Triangle Springs. It's a mental health facility, but we do the internal medicine part of it. We don't deal with the psychiatric side. And I've worked in the ER at Wake Carey as a hospitalist nurse practitioner, just doing admissions. Pretty easy job, and it was an easy way to make money. So, and it was enjoyable. You got to meet a lot of people. But first and foremost, I want to tell you the most important thing about this is to figure out what you want to do and love what you do every day. You need to get up and you need to love your profession. So just a little bit about becoming a nurse practitioner. So the nice thing about being a nurse practitioner in my mind was I had to take boards once and be done with it if I passed. And then through there's 2 credentialing bodies, ANCC and ANA, which are supposed to merge, but you get recertified every 5 years. And you do that by doing CME, or you can precept a student for 240 hours and you get partial CME credit, or you can write a book or take a class. There's various ways to achieve that. And then it's like $400 every it's either 3 to 5 years to get your accreditation. I think it's every 5 years. The other thing I wanted to tell you is you have to recertify your nursing license every year. It's like $50, and your nurse practitioner license every 2 years. Correct me if I'm wrong, you guys, but I think it's $100 every 2 years. But for the advantage for nurse practitioners are if you take the exam and you pass the exam, you don't have to take it again as long as you meet the requirements. But once you become a nurse practitioner, you'll have privileges that you're able to prescribe, you treat, you diagnose, and we do that every day. You know, in our hospital here, we have wonderful physicians that back us up, and I just feel like that kind of explains the career path that I've had and what I do every day. But I wanted to just tell you, we all come from a broad range of different pathways to get to the same degree. And, but we all kind of share the same clinical experiences every day at North Carolina Heart and Vascular. And we're happy to answer any questions that you have, but I hope you guys find the joy and the excitement we have and have all had in our career. And I hope you can continue to carry on our legacy. That's kind of my dissertation.
All right, thanks for that. And then I think we're moving on now to the Doctor of Nursing Practices.
Yes, so we have 2 more speakers. So Reginald Madden, you're next.
I'm pretty sure he's on the meeting. Yeah. Reggie, if you're here, it's your time to talk. If not, we can move on to Margaret House, and if Reggie comes back, he can talk then. Okay.
All right, we can move on and then go back.
Okay.
So, Margaret.
She's on too. Let's just give them a minute. And I know we can answer a question while we're waiting. Somebody asked how to get patient care hours during during this time of COVID. Do any of the speakers want to touch on that?
Can you hear me?
Yeah. Oh, Margaret, you're here. Yeah.
Oh,
okay.
perfect. Somebody muted me and I thought I'd unmuted myself. Sorry about that.
Yeah.
My name is Margaret House and I am a nurse practitioner, and I've probably had the most extensive trip to get to my journey here. I originally started off as an associate's degree nurse and graduated in 1988. And I did that because I wasn't really sure that, you know, taking care of people was something for me. So I decided better to invest 2 years of my life in a program as opposed to 4 years. So when I graduated with my associates and started working, and when I started working as a nurse, Marianne can chime in too, I hadn't taken my exam. And when Marianne and I took our exams, it was with the Scrantrons with a pencil, and it was 2 days paper testing, and it took 6 weeks to get results. But in the meantime, I could work as what was called an RN applicant, meaning that I was a graduate nurse, but I wasn't licensed. But I worked on a med-surg unit, and I was in charge, and it was me and one, maybe 2 LPNs and 1 nursing assistant for 40 patients at night on a post-surgical unit. So very interesting times in that things have really changed for nurses as we've grown. But decided I really loved patient care and wanted to proceed further, and went back to UNCW and got my bachelor's. And from there figured, you know, I really like this and I want to do more than bedside nursing for my whole career. And I went back to ECU and got my master's as a clinical nurse specialist. And my husband being in the military, we got transferred and ended up out in Oklahoma, which to me was, oh my God, where in the world are we? I'm in the middle of nowhere. So I took that opportunity while we were out there, when I worked as the director for critical care nursing, to go back to nurse practitioner school, because like Marianne, I love taking care of people, but knew that working at the bedside wasn't something that I wanted to do for my whole career. So I graduated with my postmaster's NP certificate in 1999 and have been working as a heart and vascular NP since then. In nursing, I did ED, critical care, open heart, administration, and knew that I loved the heart. So as an NP, I've been working in cardiology for my whole NP career. I've been here in Raleigh, and I worked for Carey Cardiology with Marianne for many, many, many years, and then went to Wake Med, and then was asked to come to UNC Rec to start up the APP program for heart and vascular. And at that time, there were some of us in the hospital, but not a whole lot of APPs. And when I say APPs, that means advanced practice providers, which are nurse practitioners and PAs. And we've done a great deal of work at REX, and everybody on this phone call that you've heard from this evening are my colleagues, and our NPs and our PAs, we all function the same and can do the same role in the hospital and in the clinic. You know, we can go into the OR as long as we've been trained. And, you know, as opposed to segregating ourselves as either an NP or a PA, even though that's what we are by our licensure, we are all advanced practice providers and support one another equally in the organization. My current role, I'm the director for the APP program for UNC Rex, and we have APPs that Rex employs as well as APPs that are from the community, and meaning someone like Gaea, who may be on the line by now, she works for our Raleigh Emergency Medical Associates, so they cover the emergency department. They're not employed by Rex, but they provide a contract service for Rex, and all of our APPs that come there are important to us, and I have responsibility over everyone to make sure that we're compliant by organizational policies, procedures. I work with the medical staff office and the medical staff to make sure that we're abiding by credentials and privileging based on our specialties, and then making sure that people demonstrate competency for the skills that they do. Because, for instance, Brandy on the phone mentioned that, you know, she first assists in the operating room. That's not something that I can do, or Gabby or Ashley or Chris, because we're not credentialed to do that. But Brandy has had special training and is competent to be able to do that. So helping to establish these guidelines so that we make sure that the APPs that we have in the organization, that we're allowing them and granting them privileges based on their knowledge, their experience, and their skill to be able to perform these appropriate procedures, et cetera, in the organization. I do some clinical, not as much probably as I'd like to do. I'm in a lot of meetings and, you know, work doing PI projects, pretty much anything that needs to be done organizationally regarding APPs I get tasked with. And I think I've hired just about everybody on the line here except for Brandy.
And Celia.
And Celia, yes.
All right, thank you so much for that, Margaret. And I think Reggie is back.
Did everybody hear me?
Yeah, yeah, we
Oh,
can.
sorry. Technical difficulty. I apologize.
You're good.
Hi, everybody. My name is Reggie. Let me put my picture on. You can see how ugly I am. I'm a nurse practitioner, also manager of the North Carolina Vascular Advanced Practice Provider inpatient team. I'll talk. Everybody knows pretty much our group. So I'll just talk about how I arrived in the role that I'm currently in. I started off as an undergraduate at Wake Forest University, and I needed 14 credits to graduate, but I decided to take a semester off to just kind of goof off. And in that semester off, I ended up getting hired at Duke as a cardiac cath lab technician. So I went from being in college to all of a sudden working full time. And in the cardiac cath lab, basically do procedures to basically put tubes in people to basically open up blockages in people's heart, or just look at overall heart function. So I did that for a couple of years and really enjoyed it, but I was bored. I had this sense of getting bored easily. So anyway, so I had a friend of mine that was a police officer in Raleigh. So he said, why don't you come be a cop for a while? So I went off and became a police officer for about a year and a half. And I shot at people, got shot at, had a bunch of fun, drove really fast cars, all that other stuff. But I realized that that wasn't it either. That's not something I wanted to do. So like how much place where you guys are in, you got to try to figure out what works for you. So part of it was I didn't make a lot of money as a cop police officer, but also my son was missing. I actually really missed being in the hospital. So I went back to the cardiac catheterization lab. I didn't burn any bridges before I left, so always leave a job in good standing so you can return. That was a point of just as a point. So I went back there, I got my job back, and then I decided, I said, I want to do something more than just be a cardiac cath lab tech. So I decided I wanted to go to nursing school so that way I could finish my undergraduate degree and do something better. So I started taking classes part-time, went over to UNC Chapel Hill, and I completed nursing school in 1998. Went back to the cath lab and worked as a nurse for many, many more years. A friend of mine that was a life flight nurse came to me one day, was a good friend, and she said, you know what, you should consider going to nurse practitioner school. I hadn't really thought about it before she had told me that. And so I said, okay. So I went to an open house over at Duke for the nurse practitioner program. And I forget, I was sitting in the front row, and the dean looked at me and said, there's never a good time to go to school. If you want to do it, just do it. So I said, okay. So I enrolled part-time, and I made my way through nurse practitioner school, and I completed that in 2005. And then I said, well, I actually took like 9 months off. I didn't go practice, became a practice as a nurse practitioner right away. I just needed to kind of take a break. But then when I did start to practice, I went and joined. I was working at Duke in the electrophysiology department. So that's something that really specializes in electric disorders of the heart. And then I also went over and started working at Wake Med. So I kind of did like Marianne did. I worked 2 jobs more than 1 job. And so I did that for several years. And then I went kind of worked night shift, I worked day shift, I worked weekend shift. I just worked a lot. I became a lecturer for different companies. I taught at Duke for a while. In 2008, I decided, I said, you know, I need more education. What I had wasn't enough. So then I decided to go, and then DNP was just came out, the doctor of nursing practice just came out. So I said, I think I want to do that, because that gives me more options down the road, especially if I wanted to manage, if I wanted to teach, if I wanted to, you know, move my career one day in a different direction, because I knew one day at some point I wouldn't want to be, you know, running around the hospital, because I'll probably be old one day. So I did that, and from 2008 to 2011, was in graduate school for the doctorate program. It's kind of nice nowadays because you guys can go straight through. You don't have to stop. You can, 3 years, you can get your doctorate in nursing practice. You don't have to take the long way like I did, the scenic way in that roads. So I did that, and after that, I still worked basically as a cardiology nurse practitioner. But I also did some teaching over at Duke. I did some lecturing on the road. I called the dog and puncher. I worked for Joint Commission as one of the surveyors for a while. Everybody knows what Joint Commission is. That's kind of almost like a certification body that goes around and makes sure all the hospitals are doing what they want to appropriately. And so I've had many, many other jobs along the way. So I'll wrap up now. So it wasn't until about 2000, I think it's been about 17 now, that I decided to go to management. And so we had an opening as manager of the inpatient team. And
I'm on a.
So we had an opening as manager. I applied, and the rest is history. I've been doing more focus in management now. I'm still about 20% clinical, probably about 80% management. And overall, it's been really worthwhile. Good career. Thanks, guys.
Thank you, Reggie. And then Gaea hopped on. She was our first PA to present, but she's on now, so she can talk to us.
Yeah, I'm so sorry. I had it written down for 8 o'clock, and I was just like waiting to get on. Sorry about that, Caroline.
You're good. We're glad you're here.
I imagine there's a certain format you guys have been following. Is there anything specific, just sort of like how I got into this kind of thing?
Yeah, just your background, where you went to school, and then what you do today on a daily basis.
Okie dokie. So I'm Gaea. I am 31 now. So I'm a PA in the emergency department at Rex. And I've been here for 2 years now. But before that, this kind of all started. I thought I wanted to go to med school, maybe nursing, but really med school. And I went to UNC for undergrad. So I was like a biology major, which is, I feel like, pretty standard if you're pre-med, but I didn't know what I wanted to do. So I shadowed a lot of people, nurses, MDs, PAs. And just because I don't have a nursing background, I didn't really shadow nurses. But I got really interested in it, and I wanted to see patients quickly. Like, I didn't want to be in med school for 4 years in residency and then, you know, be 35 before I see patients. So I shadowed a PA, and I really liked what they did. So I started to pursue that. Did a lot of shadowing hours in undergrad. And then when I was finished, I worked as a CNA for 2 years, because I went to Duke for PA school, but at the time when I went, you need about 2,000 patient care hours before you can apply. So for 2 years, I was like a CNA in a ICU and stroke unit. So I learned how to take care of patients sort of hands-on and interact with them, which was really helpful. And then I ended up going to Duke for PA school, which I really enjoyed. It's a lot of information coming at you really fast. It's like 60 hours a week. You can't work, you can't do other things at the same time, but it also is a really good opportunity to kind of immerse yourself completely in the learning. I mean, I didn't have any background like a nurse, so I mean, being a nurse practitioner, that's totally different. But for me, it was really nice because, 24/7, you're thinking about medicine. They have great resources. You're kind of all in it together. And then when I finished that, I started in the first class at Duke for the emergency medicine PA residency, which in order to be a PA, you don't need to have a residency, but if you specifically want to get into some challenging fields right out of school, it helps rather than taking several years to do different things like primary care or sort of like working your way up to that skill level. I just sort of kind of took a pay cut and worked like 80-hour weeks to do residency so I could be in emergency medicine. Let's see. So I've taught students. I know that Reggie was talking about students. So I've taught med students, PE students. Didn't really have NP students in the ED, but, worked with residents and things like that. So it's really been a lot of academics. And now I'm at Rex, which is a small hospital. So we don't have academia, but it's still really, really fun to be a part of the medical team in the ED. It's fast paced. It's not a 9-to-5 schedule, which I really appreciate. Some people really like the 9-to-5 Monday through Friday, but I get to work, 15 days a month and have a week off to go on vacation and work funny hours so I can have like Tuesdays off to do whatever. So I really like it. But it's not for everyone. I'm sure you guys will talk about this, but the best thing I can say is like shadow a bunch of people, ask as many questions as you possibly can. And then when you are shadowing people or talking to them, think about if you can imagine your life looking like that every single day for work. And then you kind of know like if that's a good fit for you or not. So I think that's about it.
All right. Thank you so much.
Oh, thanks, Caroline. I just want to quickly say thank you to all of our guest speakers, and thank you to Caroline because she was the one who organized all of the guest speakers today.
Yeah.
And so now we are going to switch over to the Q&A section. So feel free to ask your questions.
Whoever wants to ask a question, you could go ahead and unmute yourself, or if you just want to send it in the chat, we can read it off. I'll read off the first one. Somebody was asking about patient care hours during this time of COVID when I guess most places aren't accepting volunteers. Does anybody have any recommendations, or do you just say hold off until we're sort of out of this?
I could answer that. I would recommend, one, programs may be changing some of their requirements because they're very much aware that there is difficulty in getting shadow hours at facilities or in offices. I do know that at Rex, we talked about this today, in fact, that we cannot accommodate shadowing hours at this time because of COVID and PPE restrictions and conservation and things like that.
Okay, thank you for that, Margaret. And we have another question for physician assistants particularly. It says, are physician assistants allowed to go back to school to become a doctor?
I can answer that. It's Gabby. Anyone can go back to school to become a doctor if you so desire. You have to have the minimum requirements to get into medical school, and you do have to take the MCAT. And it would be, the requirements would be no different as anyone trying to enter medical school.
Okay, thank you.
You need the MCAT and you start at year one, you're an MS1. You get no advantage for being a PA.
And I will say after working almost 15 years in academics at ECU with residents and fellows and medical students, nearly every year, at least a handful of them said, I wish I would have gone to PA school, or I wish I would have been an NP. throughout that process, because they see what we do on a daily basis, and they know what they're going through, and what the docs get to. And there's always a handful every year that would say, I wish I would have gone the route that you did. So
I guess to also touch on that, I'll ask a question. Did any of the NPs or PAs here ever say, did I wish I went the full route and went to med school?
I can say that I struggled with the decision to go to medical school or to go to PA school. And one of my big deciding factors because I took the MCATs and went through all those hoops and applied, and then decided to withdraw applications because I couldn't make that commitment. And the big reason why is when I looked at my lifestyle going forward, pretty much, kind of similar to what Gaea said too, I could be practicing and taking care of patients in a shorter amount of time than it would be if I committed to all those years of medical school and residency and then fellowships. I mean, you're looking at 4 years of medical school. If you do, let's say I wanted to be a surgeon because I like surgery, I would be looking at, probably 6 years of surgical residency after 4 years of undergrad, and then 1 to 2 years of fellowship if I wanted to specialize. Vascular surgery would be an extra 2 years. So that's 12 years outside of high school before I would be practicing and taking care of my own patients. And that just seemed like a really long time for me. A lot of the PAs that I had talked to when I was trying to make that decision, a lot of them were females, and they said it's a great work-life balance to be an APP versus being a doctor. With PAs, like if I decide tomorrow that I don't want to do vascular surgery anymore, I can quit. I'm not, but I can quit and go do pediatrics. If I want to go back to do pediatrics, I can. I don't have to recertify. I don't have to take any new tests. I do have to find a doctor that's willing to retrain or help me remember those things that I learned 20 years ago. But you have that flexibility to change those roles. If I go through 4 years of medical school, 6 years of residency, 2 years of fellowship, and then I decide I don't like being a vascular surgeon anymore, well, guess what, honey? That's what you're going to do, unless you go into, some, pharmaceutical role or something, but that's what you spend all your time doing. It's not as easy to transition. So family wise, lifestyle, it just seemed like a better fit for me whenever I was trying to make that decision.
Okay. Thank you.
So I actually got originally accepted out of high school into pre-med and had a doctor talk me out of it. I had gone in to have my knees looked at. My plan was to go into pediatrics. And I actually had a physician that I told that to, and he spent 30 minutes explaining why it was a bad idea. And I feel like he's probably right. I will say, like Brandy said, being able to switch and go to something, it's probably a little easier for PAs. My license doesn't allow me to treat kids. So I wouldn't be able to go into I wouldn't be able to go to an urgent care and treat pediatric patients. But it does give you, like she said, a lot of leeway to, I don't like doing PAD anymore. I want to do heart failure, or I want to do nephrology. And you just have to be retrained.
Okay, somebody specifically asked you a question on that. They said, what did he say that convinced you not to go to medical school?
He looked at me, and among other things, he looked at me and he said, you will have a lot of money that your family will get to spend because you will never see them.
Wow. Okay. A few more questions. For a PA, somebody asked, how long is residency for PAs?
I don't know if I'm the only one who did residency. I didn't hear everybody else's thing. Sorry. The ED residency at Duke that I did was a year, but at least most EM residencies are about 18 months. They are usually 80-hour weeks, and you usually get paid what like a PGY1 would, which is like right now is like $50,000 a year, which is a lot of money. But when you have huge student debt, it's not that much money. But it depends on what you want to do, but usually it's between a year and a half and 2 years.
And again, the residencies are totally optional. I did not do one. And a lot of there are surgical residencies as well as emergency medicine, but again, that is a totally optional choice after PA school.
Okay, another question. Somebody, and this is for NPs and PAs, somebody said, are there tests you have to take to keep your certification?
So I can answer that for the PAs. So it used to be, I think, every 6 years. Now it's every 10 years. We have to redo our boards. So so that's a little different from nurse practitioners. PAs actually have to, recertify every 10 years. So we have every 2 years, we have to do continuing education, and we have to report that we have all the 100 hours that are required to maintain our license. And then at the 10-year mark, we have to take to retake our boards. And the big thing with that is that PAs don't specialize. So we have to take our boards on all specialties. So I've been working, in cardiology, but I've got to be able to answer questions on pediatrics, on ENT, on surgery, on all, urology, infectious disease, all these different things. So you have to be up on all of the most recent information on kind of all aspects and all specialties.
I think as an NP, you can retest if you choose to recertify that way, but you can just do your continuing education, your hours, like Marianne said, precept students. If you're really bored, write a book or something like that. And like my license is acute care, so while I would be tested if I chose to retest on all acute care topics, I don't have to know anything about pediatrics. I have to know very little about OBGYN and stuff like that. So it would probably be less of a thing for me to recertify because I won't have to study and test on as much.
And probably, and when I went to NP school, probably like Marianne a while ago, there were only two routes for us when we were going through school, and that was to be an adult nurse practitioner or a family nurse practitioner. And Marianne's an adult nurse practitioner, so she can see, what is it, Marianne, 16 and up?
18.
18 and up. And I'm a family nurse practitioner, so I can see birth to death and inpatient and outpatient, which is what I've been doing my whole career too.
My nightmare was I was grandfathered in. I did not have to take boards, but Duke did not send my paperwork in after 5 years, and I had to take boards after 5 years into practice, and I had to learn it all again. But I did it okay. So you pass once for a nurse practitioner, you're done with it.
I can
Yeah.
kind of
And I think one thing that's really important that you've kind of heard everybody talk about online here is that just because we've all finished our training and our license, that number one, there's a requirement for the board, and we all have to do 50 hours of continuing education a year to maintain our license by the state. But it's something that you will always be learning, every day. And if you're not open to continue learning, and I don't mean learning for a degree, I mean just learning to stay current on the latest treatments, and medications are continuously ever changing. So it's something that takes a lot of self-discipline to just kind of maintain, to be competent with what you're doing every day.
Celia, did you want to add something to that?
Oh, yes. I was just going to say, for nurses, you take your NCLEX after nursing school, and then to keep up your certification every 2 years, you either have to have, I think it's 30 contact hours of continuing education. And then you could also do, I think it's like for North Carolina, 15 contact hours and so many hours of patient care. So I think it's like 640 in combination with those contact hours. But then you don't have to take boards as long as you keep that up.
Cool. A few quick questions for PAs. Somebody asked, does any type of biology degree work for getting into PA school? For example, human bio or microbiome?
So I have a chemistry degree. So I'd say it actually any bachelor's degree. So you could have a bachelor's in art, as long as you go back and get your prerequisites with anatomy and the certain science classes and things like that. I think I had to go back and get my statistics after. You can apply to PA school. So there's no specific bachelor's that you have to have as long as you have a bachelor's.
Okay, one more question for PAs. If I'm applying to PA school with only the minimum amount of patient care hours, what other aspects of the application should I try to improve on, or any advice to make up for this?
So I can speak a little bit to this. I actually helped with the application process and interviews at ECU for several years before I moved here. GPA is important, especially in a more competitive program if you're trying to get into. So not only is patient care hours, they want to see that, you know, that you study, that you take tests well and things like that, because they want you to come in and they want you to do well. And they want you to be able to graduate and pass your boards and to become a PAC. That's the goal. And so they want to make sure that you have that under your belt as well. So if you've got decent GRE, good GPA, you've got your hours. The other thing that's gonna get you there. When you get called back for your interview process, you want to show and demonstrate that you are a team player. Not only is that important for working well with your classmates when you're in school, because you're going to need to support each other, because it's not, you know, it's not a cakewalk. You know, you struggle together, but you do well together. But it also means that whenever you leave that program, that you're going to be a good team player with the other APPs that you work with the nurses that you work with, your PTs and OTs, your docs. That's the environment that they want to get you to. And they want to have people that come out of that program that represent their program well. So if you come in and, you know, you're engaging and you're inquisitive and you act like you are excited to be there and you ask good questions and you look involved and you show that you can help support your classmates, that translates into you being a good provider once you leave their program. And that's a big thing that they look for.
Okay, I know we're going over our time limit. Just 3 more quick questions. For Celia, somebody said for nursing, before applying into a nursing program, how many hours do you recommend having?
So I guess I was the only one that didn't actually go through like a BSN or an ASN or something like that. So I think it's really more of a, what do you feel comfortable with? Getting that patient exposure, feeling comfortable going in and talking to patients. I know a lot of the people that I was in school with had never like talked to a patient before. And that was such a big hurdle for them to get over. So I think it's being comfortable going in, talking to the patient. Some people can get that in, you know, a 3-week EMTB course, and some people that takes years of being a care tech or something like that, just to get comfortable being with the patient and touching the patient and looking at the patient and talking to them.
Yeah, I completely agree with that. I also, on some of the floors that I've worked on, and then also when I was in school, a lot of the places that you'll do your clinicals at, or even where you work as a tech, if that's somewhere that you're interested in, get a job there, start working as a tech, and if you like the floor, they'll hire you on as a nurse once you get your license. And then also just right now, a lot of places are letting nurses work after you complete your degree without taking your boards yet, just because of the huge need for nurses right now with COVID and all that. But I would say just get into an area that maybe you're interested in, and they'll hire you on after you work there as a tech.
Okay. And then last 2, sorry guys. Somebody said, does having the EMTB make an application stand out more when applying to schools?
Well, so I had the EMT. I don't know that it necessarily weighed one way or the other on my application, as much as it was just a good opportunity for me to get my patient care time. Like, I don't think that you necessarily have to have any specific credentialing, additional like certifications for your application. I think it's a matter of, so I applied the first year, I applied to all the schools in North Carolina and I didn't get into any of them. I had all of my, I had a good GPA, I had all of my hours and all of my prerequisites, and I did my GRE and all of that. But I had my letters of recommendation redone by more specific like medical background people, because I had kind of different background with my work experience and things. So I actually just switched up those and reapplied the next year and got into multiple programs. So it's kind of interesting that was kind of the only variation there to what I had to be able to kind of check that box for them. And maybe it was the fact that I was willing to come back a second round and I stuck with it and still got in. Yeah, I don't think that, EMT specifically is, gonna do anything one way or the other for getting in, as much as just having experience. And like Chris was saying, showing that you've taken some time and you're comfortable with patients and interacting with people. It's hard to just go up to the general public and start talking really personal things with them and get what you need. And being able to do that is kind of a skill you've got to hone and know that you have that kind of aspect in your personality that you're comfortable with.
Okay. Last question.
I also, I kind of wanted to touch on this earlier. I also think that the experience that you get from pre-hospital medicine, EMS, even if it doesn't help your application, I think it will help your practice, because it's always something different. It's always a different situation. It teaches you to be on your toes. It teaches you to, make decisions with limited information. So I think even if it doesn't look good, it's a good way to get that patient contact experience, to just learn different things. And it may not help you on the application, but I think it'll help you in your practice as you go forward.
Okay.
I have a thing too. It'll just take a second.
Yeah.
I recommend you guys, if you have specific places you want to go to school or specific anything, talk to the school, talk to the admissions board. You can contact them. They're like an open book. They're happy to talk to you. You can read, your experience to them, your GPA, everything, and they will give you real feedback and say, hey, we're looking for more of this, or you're not meeting this. But generally they're super nice. They want you to come to their school. They want you to be interested. And so if you have specific questions for specific schools, especially, talk to them. They're open.
Okay. One more question, Gaea, you might be good at this. Someone said, how difficult is the GRE, and what are some tips to know about when studying for it? When should we start studying for it?
Yeah, so it's basically like a longer, harder SAT. So I wouldn't worry about it too early. I would worry about it like sort of later. Don't do it during college. Like, you have plenty to worry about. If you're good at like basic stuff like the SAT, like if you're good at standardized test taking, you're going to be good at it. You just need to look over the material. If not, they have these great like study things you can do. You can sign up for online things. They have books. They have online questions, interactive stuff. And it's just like the SAT. It's pattern recognition, like different kind, like there's basic math, but you just have to know like the formulas and stuff. So it's just like normal standardized test taking. So if you're bad at that, study extra. If you're not so bad, I just like read through a couple of the study books like cover to cover, and that did fine for me.
Okay. I think that's all of our questions and all we have time for. But before we end off, I just want to say thank you so much to our guest speakers. You guys are awesome. You really made an impact today. I know everyone loved having you guys. And make sure to check your mailboxes at Rex tomorrow. There might be a surprise from our club in it. So thank you.
Thank you. I just wanted to talk quickly about our next meeting. So it's in 2 weeks, Tuesday, 7 o'clock, which is the same time as today. and it will be with Haley Witt. She is a PA. So she's going to delve into her experience. I think she might be presenting a PowerPoint. And then as always, we'll have a Q&A session at the end. And I think you wanted to say something?
Yeah, I was just going to add that thank you guys for all coming to our first virtual meeting. I know that it's kind of a weird year and we're all kind of getting used to it and trying to work out the kinks. So thank you really for standing by, logging on, checking us out. I just want to emphasize, I think a point that was really made tonight is that it's really important to just hear as many different experiences as you can and really just keep your opinions open to different potential jobs and journeys that you may go on. None of the people that we heard from tonight went on a clear path, and they all turned out amazing. We had amazing speakers. So I just want to emphasize, like, that's what our club is about. That's why we have a PA and a nursing side. So you can hear both. Like, if you're really set on being PAs right now, like, don't not attend the nursing meetings and vice versa, because you'll never know what you can hear. It might change your mind. So yeah, thank you guys so much. We have our meetings every first Tuesday of the month at 7 p.m. So just look out for our Zoom links.
So the four officers are going to hang back, see if you have any questions, but you're all free to go. And if you have any questions, you're free to email me anytime. I try to respond very quickly as soon as I see it, but anyway, that's all.
Thank you guys. Oh, sorry. I was just going to say, and if you guys want to rewatch our meeting because you might have logged on early or late, something, we're trying to record it and we're going to try and get it posted for you guys as soon as possible. So again, look out for your email. As soon as we have that accessible for you guys, we want you to be able to view it and tune back to someone that you found particularly inspiring. So yeah, thank you guys.
Thanks so much, everyone.
I will send out an email as to where it's posted and all of that, probably tomorrow. I'm not exactly sure how it's going to work yet, but as soon as I know, you will too. All right, so thank you.
Thanks, guys. Everyone's logging in.
We gotta stay. Those were really great talks.
I loved it.
They were great.
Yeah, it was.
That was awesome.
Can I say something?
My mom wants to say something to you guys.
So Margaret is the director of all
Margaret's still on.
Yeah, is the director of all the nurse practitioners and in charge of everybody that was here tonight. But you can reach out and ask us questions. Because COVID's happening doesn't mean it's forever, you know, and there will be opportunities in the future. It's just, we got to get through this pandemic that we're going through. It's a really difficult time. I was hoping somebody to ask a question about COVID because we're seeing a lot of really sick people here.
Mm-hmm. Yeah, and I can't imagine.
Yeah, so it's worse than you think, and so take it seriously and spread that to your colleagues.
Yeah.
You know. So that's all. I just wanted to tell you, don't think it's never. You know, when we get over this, there'll be opportunities again.
Thank you.
Thank you guys so much.
I know that was such a good meeting.